every patient, every cancer patient is different. Alcohol, cigarette, vodkas, and they will spoil their life.
It's just like one who have got cancer, got cured, he got cancer again.
It is there.
Possibility.
I'm not denying that possibility is not there. The treatment is not very expensive. So how much a patient, and for poor patient, the government has provided card, GJ card, Gopabandhu card. In that everything is free. Many people think cancer is a curse, like some bad deed of them. So God has given them punishment. So they want to hide it.
Welcome to this special Cancer Day episode. Today we are joined by Dr. Sanjaya Mishra, a senior oncologist, for an expert discussion on cancer awareness, early detection, and care. Welcome, sir.
Namaskar.
Before we begin this Cancer Day special episode, let us first know what is cancer.
So cancer is any abnormal growth of cell or division of cell and sudden growth at that part of body. And basically, if it is neglected or we leave it like that, it will spread to other part of body.
Can cancer occur in any part or any organ of the body?
Yes, it can occur at any part.
What are its early signs?
If you give a chronic irritation at certain point for years together, so it can be an injury, it can be a virus, it can be some addictions which is irritating to that area. So slowly changes happens in that area. And early signs depends on the site of cancer. You see head and neck cancer, you will have swallowing difficulty, you will have a mass or node in the neck, you will have an ulcer, non-healing ulcer, you can have bleeding or swallowing difficulty. All these can be a symptom of head and neck cancer. There is if you suspect breast cancer, there can be a lump, there can be change in color of the breast or the size difference in the two breasts, or there can be some nipple discharge, reddish discharge, greenish discharge. So such kind of thing can happen. There can be a lump inside the breast. So if you think a cervical cancer, there can be irregular bleeding. Once you are doing PV, you can find a mass at the cervix. And similarly, if a GI tract malignancy, you can have vomiting, or you can have dysphagia, and you can have blood vomiting. Colorectal cancer, you can have blood in the stool, pain abdomen. So multiple cancer, there will be multiple symptoms. So you need to know what are the symptoms of cancer of that area. Then you'll be able to come to the doctor that I may have this kind of cancer.
Recently, in India, cancer is often detected on the very last stage or the later stage.
Yeah.
So why do you think so?
But that's lack of awareness. People doesn't know that this can be a symptom of cancer. There is an ulcer, they keep on neglecting. Some medicine will be given by the doctor. It subsides a little bit. So negligency and lack of awareness. There will be cough. People will be taking medicines. Asthma, they think it can be asthma, so they take inhaler. A lot of medicine they will be taking, but they will not do a simple X-ray or CT scan. Similarly, bleeding will be there. They will take some medicine. Bleeding will subside. Again, after 2-3 months, it will start. So they lose the critical time when early detection is possible. And many times they think, suppose they think it can be cancer, they think, anyway, I'm going to die. So why to go to the doctor? So many people think cancer is a curse, like some bad deed of them. So God has given them punishment. So they want to hide it. So that is another reason.
Sir, is cancer curable?
Absolutely. Cancer is curable. Cancer is curable. Stage 1, 2, 3, they are curable. Stage 4, the percentage reduces, stage 4A. Stage 4 metastasis, when it goes to other part, it becomes very difficult. Otherwise, stage 1 to 90-95% cancers are curable. Apart from breast cancer, where it is 5 to 10% is genetic risk is there. Other cancers, there are very few cancers where genetic risk is there. Mostly the cancers are acquired. Acquired means from the society, from the pollution happening, from the addictions, from the food they are taking. So lifestyle plays a major role.
In recent day and age, AI is booming. Do you think AI can help in early detection of
Absolutely,
cancer?
absolutely. See, we are getting a lot of help from AI. At least you search anything, what are the early symptoms, what are the screening tests, people can get. And everybody is using mobile nowadays with Android mobile or iOS mobile, where they can get all this information. So AI can help them knowing that they can increase the knowledge, but AI cannot detect for them.
Most people think it is as curse because it is not affordable. So do you think cancer treatment can become affordable?
Cancer treatment is not very expensive. So how much a patient, and for poor patient, the government has provided card, GJ card, Gopabandhu card. In that, everything is free. Say from diagnosis to radiation, surgery, chemotherapy, everything is free. So they provide 5 lakh to males and 10 lakh to females. In that, they get all the treatment absolutely free. So a surgery, suppose a head and neck cancer, you say. The surgery costs around 1.5 lakh. Radiation will be 1.5 to 2 lakh, and chemotherapy will be, if needed, will be another 50-60,000. So 4-5 lakh every treatment gets over. Unless patient is very advanced and they need targeted therapy, immunotherapy, cancer treatment is not very expensive. And once the treatment is over, they just need to follow up every 2 monthly, 3 monthly, then 6 monthly once. It's a myth only. They think it is very expensive, and that's why they don't come. They think that we have to sell our house, or why to do that? Anyway, we are not going to survive. So let's keep the money for the next generation.
What other myths do you think are associated with cancer?
I think intake of sugar can increase cancer. So cancer cell doesn't eat sugar and grow. So the patient can take sugar. And they think that cancer patients are infectious. Nobody should sit with them, eat with them, or sleep with them. Cancer is not an infection. As I said, it is the abnormal growth of certain part of body. It is absolutely non-infectious. Rather, those patients who are suffering from cancer while they are taking treatment, other people can infect them. So those patients they can absolutely eat and sleep with us. It's not an infection.
Recently, the AQI of Bhubaneswar is increasing a lot. So do you think that will also give rise to a lot of cancer?
Absolutely. Lung cancer and pollution-related cancers will increase absolutely. And not only cancer, chronic obstructive pulmonary disease, so lung-related other things also. There are other, apart from cancer, there are some lung diseases that will also increase.
I think that enough mental health support is given to the cancer patient.
I don't think they're getting. So, firstly, we doctors, we need to counsel them from the day one, like we are there for you. So once they counsel for the half an hour, they should feel very comfortable. So that moral boosting is needed. And while treatment is going on, that emotional support from family, friends is needed. Once patient gets cured, the society, the employer who are employing, they are also discriminating nowadays. They think it's a cancer patient, he may recur, so they stop their promotion. They don't accept them as equally as the other people.
So we have seen cases like one who have got cancer, got cured, he got cancer again.
That possibility is there. I'm not denying that possibility is not there. So, and that time also treatment is there. So many cases, even stage 1 to 5% case can recur. Stage 3, 30-40% cases can recur. But 70% getting cured. So you should not discriminate them. And they rather try to live a more healthy life. If you support them psychologically, socially, they will feel good. Otherwise, they will again go to that habit, alcohol, cigarette, vodkas, and they will spoil their life. So this year theme is United by Unique. So what does that mean? Cancer is a unique disease, and it not only needs the medical treatment, it needs the emotional support, it needs the psychological, the society support also. So, and every patient, every cancer patient is different. We cannot say that this is a particular cancer and every patient will get the same treatment. So it depends on the patient age, patient choice, everything. So every cancer patient should be treated differently. And it needs multidisciplinary approach, not only the doctor, the friend, the society, everybody has to think. So that is the theme of the year. And people should get aware that how we will live a healthy life, how we'll avoid all the addictions, how we'll choose healthy food, how we'll do some exercise, maintain fitness. So that moral responsibility everybody should take. So that is my message to all the people. So
thank you, sir. Thank you so much. Thanks. And to all our viewers watching this show, remember to exercise, eat good food, and to go for early detection if you feel something is irritating. Stay informed, stay tuned to Odisha Post Live for more such updates.